1.
Right. Good afternoon, everybody. Here with Paul and Deirdre Gifford, Public Health. Josh is here electronically. It's been a few days. Let me just give you a quick update on where we are. 192 positive cases out of 10,372 tests. That is, for the third day in a row, a positivity rate of almost 2%. It's 1.8%. We're watching this carefully. We had a spike up in, for example, many communities in New York City. So I hope we haven't seen this movie before, but it's something we're paying a particular attention to. New York City went down a little bit the last day, so we're still bopping around the bottom there. We're trying to figure out what are the trends out there, and one of the things we're following is where those hot spots might be in our state, just like there are a number of very infected communities in Queens and Brooklyn. One of the things that Josh has been able to do is our wastewater alert, where we do the testing of the wastewater. It gives us an idea, an early indication, a few days early in terms of what might be going on. And this is an analysis of Norwich, which, following Danbury, is probably where you have the hot spot now. And again, you can see the upward curve there. If we have a quarantine of any place that has 10 per 100,000, Norwich is at 24 per 100,000. They're at 6.7% positivity, which is probably more than three times more than what we have in this statewide. So this is just why Deirdre's out there right now. We've brought the rapid response team. We've got them on alert. They're doing their press conference as we speak. Rapid response team is providing free testing across the board, bringing in extra track and trace people to go right at where there could be a flare-up in Norwich, and we try and get a better idea of what is happening there. There's no easy answers. I mean, you could say maybe it's schools. Well, New York City has flare-ups and their schools aren't open. In Norwich, their schools are open on a hybrid basis. We'll see later on that about 40% of our schools are open full-time. You know, we've had issues with the nursing home there in the past, some infections at the hospital as well. So we're part of the track and trace, see what we can find. There are about 3,000 folks who work at the casinos who are there, but no significant flare-ups that we found testing in those communities as well. But there is some community spread. So what that means is residents are encouraged to take extra precautions. I know there have been some public comments of people who are dismissive of the importance of the mask. Be dismissive no longer. I think you can see that it does make a difference. If you're feeling sick or you feel like you maybe were exposed to somebody, stay home. I hate to keep repeating myself, but I think it bears repetition. And look, if a contact tracer gives you a call, answer the call. Do the best you can. This is how you keep your family safe and your community safe. Let's see. Next up is Mathematica, and that's the outside analysts who gave us some insights in the nursing homes. As you know, Connecticut, like most of our neighbors, were hit hard in the nursing homes with infections and fatalities. We're one of the few states that decided to do a complete analysis, share it with you, give you our best insights we can from outside experts who have looked at other situations around the country so we can learn from it and do better going forward. And probably nothing that surprising, and a lot of things we're already doing, but it's still worth reminding people that nursing homes that were hit hardest are in those areas of community where there's some community spread. Maybe you've seen some of that in Norwich as well. Our rate of infection and fatalities were very similar to New York, Massachusetts, Rhode Island, our neighbors. The adverse impact of visitation restrictions is impacting the well-being of nursing home residents. That means early on we said no visitations, and that was really helpful, I think, in terms of stemming what could have been an even worse spread. Then around Mother's Day, we said, look, you can have outdoor visitations just to bring some, well-being to our loved ones who are at the nursing homes. And we're continuing to open that up a little bit as we speak right now for people to do in-person visits. But that said, one of the things that Mathematica reminded us of is that human contact is really important for emotional well-being, and we've seen some impact of that. Look, we're already doing a lot of the recommendations that Mathematica had said, just getting ready for what could happen in October, November, if we did have a second flu season. You know, we have already been testing on a frequent basis, at least monthly. We're doing it at no charge to the nursing homes. And if there's an infection, we'll be testing on a weekly basis, even more often. And really working with the nursing homes in terms of training and the infections protocols, making sure they get that right, because those nursing homes that didn't get that right were the most likely to suffer severe consequences. And so ongoing, we're still one of the most robust in the nation in terms of taking care of COVID at the nursing home level. But you've seen in Norwich, we saw previously, now there seems to be a flare-up in a Colchester nursing home as well, which Deirdre can talk about. So we're not out of the woods, and we have to be very diligent about these flare-ups. Let me take you to a little better good news, I would like to think, and that's safely reopening our schools. You know, many places, New York City, California, the schools aren't open at all. New York City is just beginning to get going. So in our state, almost 40% of pre-kindergarten through 5th grade is fully in person. What that means in terms of mental health as well for young people, getting to be with their peers and friends. A little less for 6 through 8 and a little less for 9 through 12. Again, high school, a little more complicated because you're less likely to be able to cohort with just one group. And I think you can see the hybrid numbers. And then the fully remote numbers are still New Haven and Danbury. Danbury because they did have that flare-up going back a few weeks. Overall, it's just worth remembering that we have 133 students and staff out of 600,000 or 700,000 who have tested positive over the last few weeks. And Josh reminds me that almost all those who tested positive, that did not happen at school, that did not happen in the classroom, that happened off campus, so to speak, maybe a party, maybe some sports, but that's perhaps the classroom is one of the safest places you can be. For those that don't feel comfortable or shouldn't be going to school at this point, the good news is that 30% of people never activated or logged on their computer back in the spring when we had to discontinue in-person learning. Today, that number is down less than 5%, 3.7%, which means better than 96% of all of the students who are remote learning are logging in, and that's in part thanks to our Everybody Learns initiative, where we provide the computers, we provide the instruction, we provide the Wi-Fi, or provide the IT connection to make that easier to do. So I got to give a shout out to our teachers and administrators and students. I think you've been following the protocols very carefully, and that's why every week a few more kids have the opportunity for in-person learning. With that, let me just open it up to any questions. Remember, Josh is here via Zoom, and Deirdre to answer any questions on the public health side. And Paul was very active when it came to the special session. The House has already voted, and the Senate's doing the same right now.
News 8.
Good afternoon, everyone. Governor, you had mentioned the situation with the nursing home in Colchester. Back a few months, as you saw some of the states open places and then have to close them, there was reason to pause. With what's happened in Colchester now, do you think about maybe going back to the restrictions that were before that you relaxed recently because of this outbreak?
Well, when it comes to the occupancy in restaurants and theaters and such, that's not even taking place until October 8th. But your bigger question as regards Colchester, I think it does reflect a little bit what's going on in the greater Colchester community, and that's what we're watching. And the number of infections there was pretty high. Deirdre?
Yes, so the guidance that we recently
issued around relaxing visitation in nursing homes in particular, it will change if there is an outbreak in a nursing home. So not only will we be doing increased testing under the program that the governor mentioned, but there also will be restrictions on visitation when there's an outbreak in nursing homes. So that guidance fluctuates depending on the cases happening in the particular facility.
Governor, I believe last week we had talked a little bit about Halloween and what that would look like moving forward. Now, I know from what I read, apparently you're leaving it up to each jurisdiction. Any thoughts now about, as we get closer to Halloween, what that should look like?
Yeah, Max, we have one slide that may give people an idea of what it could look like. But more importantly, Deirdre's issued some guidance in terms of Halloween, how important it is to wear the cloth mask. You can go to spookyclothmask.com to get one that's Halloween appropriate. She will recommend, and public health has recommended, that stay within your group, stay within your cohort. No, big mass of people walking around. Same type of advice we give in schools going forward. And what you see here on this Enjoying a Safe Halloween is two clever folks that said, look, no need for you to go up to a door, no need for the patron to hand candy to people. That's a little less safe. And these are both two people that have created a chute so that you come to the door and the candy comes right to you. You don't have to get that elaborate, but it gives you some creative thinking.
Governor, if I may ask you one more, you mentioned an uptick in southeastern Connecticut. From what I understand, Senator Ostin had kind of raised the flag that there were increases in southeastern Connecticut some weeks ago, and was told, not to worry, that it has been contained. Is that true? Is it a thing where it seems like maybe that wasn't taken seriously enough? No, that doesn't make any sense to me at all. I think Deirdre, public health team, take it very seriously. Let's face it, Southeast Connecticut was much less likely to get hit by the COVID infections going back a few months. They were probably more interested in opening up sooner. We've erred on the side of caution there as we tried to treat Southeast Connecticut along with the rest of the state as one. But we are following this very closely, and we'll take appropriate responses as needed.
NBC Connecticut.
Hi, Governor Lamont. We're getting a lot of reaction on our NBC Connecticut Facebook page to the new Halloween guidelines. Obviously, some people are being critical, saying they want to be able to make a decision to go out and have a fun night with their kids, or question the reality of giving out candy while standing 6 feet away. What do you say to parents around the state?
Well, to that first group who said they want the opportunity to go out with their kids and enjoy Halloween, we're not standing in the way. We're just giving you clear guidance on how you can do that safely. For those of you that don't want Halloween or don't necessarily want kids coming up to your door, maybe you've got a pre-existing condition or you just don't think it's the right thing to do, you can probably skip this Halloween and keep the door closed.
Is there any chance of an executive order codifying that guidance or setting up enforcement in some of these cases?
Well, I think we've issued the guidance, right, Deirdre?
Yes. Guidance was issued today.
What would it take for you, switching gears, to consider additional restrictions in some specific hotspot states or towns like Colchester or Norwich?
Well, the first thing I do on a local basis is look at schools and sports, since that is more local. And if I saw a flare up there and working with Deirdre and Josh, we would make a determination and give a strong support to the local superintendent in terms of what we thought should happen. Obviously, in Danbury, for example, when things spiked up to 7%, I think Mayor Boughton, working with the superintendent, appropriately said too early to open schools, even on a hybrid basis.
And if I may, one last question.
One second before you go in. One thing I'll also add, in addition to the work that DPH is doing, they're also going to increase the communications about the importance of wearing masks. And I think this is a great opportunity for all of the public officials and people within the community to play a part as well to talk about the importance of wearing masks. It's quite ironic that we do have individuals who are actively suing the state of Connecticut when it comes to wearing masks and understand the importance of masks that has been said by the World Health Organization, the CDC, Department of Public Health, and their own local health directors. We need people to wear masks, and we need people to take this seriously, and it starts with the very public officials who represent these constituents.
Thank you. And the last question, just given the uptick in cases and hospitalizations, is now the best time for phase 3? I know it's not until October 8th, but it seems like we might not be trending in the right direction. Are there any conditions that would cause you to delay or scale back the start of it?
Yeah, if I saw more Norwiches happening with that hockey stick increase, I would definitely look at it. But as I said before, when it comes to schools or restaurants, and we've had restaurants at 50% for the last several months. We've had outdoor dining for the last 4+ months, I think it is, and you've seen the rates go down. So I don't see a cause and effect. Let's put it that way.
Thank you.
Fox 61.
All right, good afternoon, Governor. A couple of weeks ago, you announced fines for refusal to wear a mask or for participating in or hosting large events. Just wondering if you have a sense of how many fines municipalities have handed out and whether you think this policy is having a positive impact on compliance.
You guys know that? Maybe Josh?
Yeah, as mentioned, we're not we're not collecting the data from the municipalities on any fines they've issued. I don't think there have been many, if any, but we've received many thank yous from municipal leaders for putting that in effect, giving them that tool in their toolkit to help ensure that in their local communities, folks are doing the right thing, following the rules. But that was really always at their request and at their discretion.
All right, and as a small state, we had some trouble getting PPE here at the beginning of this pandemic. What can we do now to move the state a little closer to the front of the line when it comes to distribution of a vaccine?
Well, first, when it comes to PPE, we're taking control of our own destiny. We've got a 90-day supply of PPE. I'm not sitting around waiting for a national stockpile. When it comes to the Abbott Lab 5-minute test, that's being distributed on a per capita basis, which is good. I didn't want, favorite sons to get that. And I think the same will be done on the vaccination basis.
And if I could add, we just issued, the Department of Public Health just issued an order requiring nursing homes to have a 30-day supply of PPE. We continue to see nursing homes from time to time pop up with shortages, and so we have made it clear that as of October 16th, they all need to have a 30-day supply on hand, and we'll be looking at that when we go out and do our inspections.
Is it possible that our success in fighting COVID-19 will work against us when it comes to vaccine distribution? It will look like the need is not dire here.
I think you're finding as you look around the country that one week you have a very low infection rate and another state has a higher infection rate. So my instinct is going to be they will probably target based on need, that's for sure. But they're working right now with Deirdre and Reggie Eady in terms of coming up with the populations that we want to target and prioritize for vaccine. And I'm pretty sure that's going to be distributed on an even basis to the different states.
All right, Governor, thank you.
Channel 3 Eyewitness News.
Yes, question for Dr. Giffords. Going back to the Halloween guidelines, do we really foresee a huge negative health impact from one night of outdoor trick-or-treating as opposed to something like maybe indoor dining, as long as, masks are being worn and social distancing is being adhered to?
So what we say at the beginning of the guidance is, in fact, just what you were talking about, which is we don't think it is necessary to cancel Halloween activities, but there are different risks associated with different of the traditional activities on Halloween night, and we're recommending that people avoid those higher risk activities. We direct everybody to look at the CDC guidance, which is very helpful and very clear, and we based our guidance largely off of that. And, you know, it won't come as a surprise to hear that large parties, large parades, anything that encourages people to congregate together in close proximity is strongly discouraged. But activities that are outdoors that you can do within your family unit and where you're keeping a safe social distance with a mask on, we don't think that those things need to be canceled, which is why we issued the guidance that we did today.
And taking a look at the big picture with this virus, we were always expecting an uptick in the fall, but where we are right now at the beginning of October, is this where we thought we'd be?
I'm not positive I ever knew where I thought we would be, but you're absolutely right that Dr. Coe, Dr. Gottlieb, Dr. Emanuel, Deirdre have all said, look, if there's a risky period, it's probably that October-November period. It's flu season. We saw back in 1918 a little resurgence. So that's why we're taking this very cautiously. And 1.8% is you know, less than half the rate nationwide, but a little more than where we've been over the last few months.
News 12 Connecticut.
Hi, Governor. So I'm just getting a look at the mathematical report that you guys just released. It looks like one of their key findings is to tailor a specific approach to reopening nursing homes to visitors as opposed to a statewide approach. What would you tell families about what they can expect moving forward based on what you learned from the report?
Want to take that, Deirdre?
Yes, so it really comes down to what's happening in the community that the nursing home is located in. What we've seen both in Connecticut, and this is consistent all around the country, that if your nursing facility is located in a community that's experiencing community spread, that's when you're more likely to see infections introduced, unfortunately, into the nursing home. So what I would say to families, A, is please abide by the guidance that your loved one's nursing home will be issuing around visitation. You need to have a symptom check. Certainly if you're not feeling well or if you've traveled to one of our travel advisory states, don't go to visit your loved one. You're going to need to wear a mask, of course, when you visit with them, and we want you, unless this is an end-of-life type of a situation, we want you to stay 6 feet away from your loved one during these indoor visits. And you can expect that if we start to see cases in the facility or the community spread in the surrounding community goes up, you can expect to start to see restrictions again until that situation improves.
So what's the metric there? Is there a certain infection rate that you're going to be looking for in a community to clamp down on visits?
There actually is, associated with some of the CMS guidance, that talks about the levels of infection in the surrounding area, yes.
So what number should families be looking for, and if they see that in their community, they should expect some more limits?
There are different cutoffs. I believe the CMS guidance talks about 10 cases per 100,000 as one of the benchmarks to look at, and there are different actions to take depending on what the thresholds are that the community has met.
All right, thanks everybody.
WTIC 1080 News.
Good afternoon. Back in March and April, you put in thousands of additional beds, field hospitals that thankfully did not need to be used, most of them for COVID patients. If the surge heads up, are we looking at that same process again, October, November, and so on?
Well, just remind you that we've got a little over 100 hospitalizations today related to COVID compared to 2,000 back at that time that you're referring to. But you're right. Depending on what happens, we're prepared to move quickly to make sure there'll be bed capacity as needed.
And I will also add that one of the major
Dr. Gifford.
1 second.
Go ahead.
It's also one of the major reasons why the governor put forth the request for an extension as it deals with the National Guard for 100% reimbursement. General Yvonne and his team at the National Guard played an amazing role to standing up those field hospitals, and we're ready to move forward with that when and if it's necessary.
Dr. Gifford, do you feel the need to emphasize how transmissible the disease is? You know, people are concerned about football, that's understandable. People are concerned about Halloween, that's understandable. There was a football game postponed nationally for Sunday, and people are worried about their fantasy teams. Do you need to kind of slap people around a little bit verbally and say, look, this is transmissible, this is deadly, you know, take this seriously?
Well, that's not really my style exactly, but I would thank you for the question because, yes, it is an incredibly infectious disease, unfortunately, which is why we see the kind of spread in places like nursing homes, correctional facilities that we have seen. So I guess people may be tired of hearing it, but you cannot emphasize enough the importance of the mask. That mask prevents you from projecting those infected droplets into the air and potentially spreading an infection. Remember that 40% of individuals who have a COVID infection do not have any symptoms. And so you may feel fine, but it's still really important to wear your mask up over your nose and keep it on whenever you're with anybody who's not a member of your immediate household. That's the most important thing that we can do to prevent the spread. Washing your hands and keeping that distance. I think what we're seeing in a lot of cases, not only in Connecticut but around the country, and I've said this before, but it's worth mentioning again as we go into the holiday season, we tend to let our guard down around friends and family and coworkers. Whether it's in the lunchroom, at the workplace, or if you're having family over for Sunday meal, if you don't live with that individual, they may, in fact, have the infection and have no symptoms. So it may feel awkward a little bit to be with a family member and ask them to wear their mask and for you to put a mask on, but that's what's going to prevent this kind of community spread. The last thing I'll say is, if you're not feeling well, please stay home. If you've been contacted by a contact tracer and you've been exposed, please stay home. If you need help staying home, if you need support with food or other resources, the contact tracing team can help connect you to the community resource counselors that the governor announced yesterday. We have resources that can help you maintain that 14 days of quarantine, and so please take advantage of them.
Thank you.
The Hartford Current.
Thanks, Max. I had a couple questions about the Mathematica report, and if possible, one about the Colchester situation. On Mathematica, Governor, one of the things I took away from my quick reading of the 157-page report is that they're saying that at the beginning of all this, the state spent most of its focus on hospitals and, in effect, ignored the long-term care providers and, in their words, possibly neglected the nursing homes as far as what the priority was. Do you agree with that, or what's your take on that?
Well, I agree to the degree to which we really looked at those hospitals very early on, just given the nature of the spread, what we saw going on in Italy and some other places where hospitals were being overwhelmed. Worked hand in glove with the hospitals to make sure that we had a coordinated response. But I don't think that was at the expense of the nursing homes. I mean, very early on, we were one of the first to say no visitations, just given the nature of the spread. We were one of the very first to have special COVID-only facilities, first wings and then facilities themselves, just to make sure those with infections were segregated from the rest of the community. And we did everything we could to get them masks. The hospitals were better at getting their own masks. We had to get the masks to the nursing homes as best we could. Anything else to add to that, you guys? I
would agree. I think that there was a lot we were learning at the beginning of this pandemic, and this is reflected in Mathematica's conclusions, that Connecticut, along with the rest of the country, was learning about this virus as the pandemic was happening. And so we took steps as we learned that they needed to be taken, as we learned about the nature of the infectivity and the spread and where it was happening. We took those steps. So I think the governor's assessment is exactly what's reflected in the report.
One of the other things is they talk about possibly the need to have full-time infection people in each nursing home. I'm just curious, is that a possibility? I mean, is that something? I mean, the state would have to fund or be involved in, or is that something you would ask nursing homes to do going forward?
They do. We currently do require an infection prevention specialist. That's a federal requirement. Mathematica asks us to consider whether that person should be required to be full-time. So that's something we'll take a look at as a result of their report.
And the other thing, I'm sorry, on the Colchester situation, the chief medical officer for Genesis said that they believe that the outbreak was caused by a patient, a dialysis patient, I believe, coming from Bacchus Hospital. We also know that that Three Rivers patients went to Bacchus and infected some people there. Has the state considered the possibility that that Bacchus is now the center of this outbreak in that area, and that employees there who were infected, or maybe there's more than we know, or who does the contact tracing for that hospital? I believe it's the hospital themselves. How confident are you that it's not the hospital that's now causing the outbreak in Colchester and in Norwich?
Want that one?
Yeah, I would really caution against an approach that identifies a particular entity as causing an outbreak. As we were just talking about, this is an extremely infectious virus, and it spreads extremely easily. And so when you're having spread in the community, the infections are going to pop up in places where people in that community work and socialize. So the contact tracing is done in a combination of ways. First of all, in the hometown where that individual lives, the person who has a positive test, the local health department or with the state as a backup will contact them, ask about their contacts, their workplace, et cetera. In the context of a healthcare facility, they will also do the work of understanding the coworkers and the patients or clients who may have been impacted by a positive coworker. So there's a combination of contact tracing that happens in those situations.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Dr. Gifford, I think I've got a variation on Dave Altamari's question. We know that nursing homes were sharing staff, and I wanted to know if there was a connection between the Norwich nursing home and the Colchester nursing home on that level.
Not that I'm aware of.
Okay, thanks.
The Connecticut Mirror.
Thanks, Max. Commissioner, could you talk a little more about the enhanced testing and contact tracing, specifically if it'll be additional local health personnel, if DPH staff will be there, if it's also going to be limited just to the city of Norwich, or if it's going to be more in the greater Norwich area, because we haven't talked about it, but there was also an outbreak at a nursing home in Groton. So we've really got 3 outbreaks, Colchester, Norwich, and Groton, in a relatively short amount of time.
So let me talk first about the rapid response team, which is around community testing. And I think as we speak, or we've just completed in the last couple of hours, further connections between our rapid response team led by Josh's office and local officials in Norwich. So we have community testing partners there, and we're going to be supplementing those to make sure that we have widely available testing in Norwich, and as you mentioned, the surrounding areas. We've seen a little bit of an uptick in Preston and Windham as well. So we're making sure that testing for asymptomatic individuals, which is being funded by the state with federal dollars, is available. In the nursing homes, that testing is part of our testing partner program that we've had in place for a number of months now, and that ramp up in testing happens almost as a matter of routine when we start to see an outbreak in a nursing home.
Okay, and just to clarify again, this rapid response team does include, this is state personnel working with local health officials?
So the rapid response team is your state officials, but we work with what we call our community testing partners. These are hospital systems, federally qualified health centers in most cases, and we've got standing contracts with them so that when we see an outbreak like this, we can ask them to please deploy additional testing resources out to these hotspot communities. And whether that's within the four walls of a building or some kind of a pop-up testing site, those entities are under contract with us to perform that service. So those are not state personnel doing the testing.
I see. And just one other clarification. Earlier, the governor referenced a 6.7% positivity rate. Was that for the city of Norwich, or was that for a larger region?
For the city of Norwich.
Thank you.
CT News Junkie. The Waterbury Republican American.
Thanks, Max. I was looking at the hospitalization numbers. Show about 11,700 hospitalizations, 9,400 discharges. If there's 100 people in the hospital today, does that mean there's been 2,200 people who've been hospitalized and died in Connecticut?
I'm trying to figure out what those numbers are, Josh.
I think you're talking cumulative, Paul. We can get you the precise numbers.
The cumulative numbers you guys put out every Thursday on hospitalizations indicate roughly 11,700 hospitalizations, 9,400 patients discharged. There's a little more than 100 hospitalizations today. So does that mean 2,200 people died in the hospital?
Yeah, we can get you the precise numbers, but the logic you're using is correct.
Okay. And I looked at the weekly stats on the number of tests coming back. And, you look from August 15th, it's been steadily increasing. It's doubled from about 640 to a little over 1,220. Is that some sort of trend? I mean, can we expect to see that continue to double over the next couple of months, or is that the concern with the October, November, December timeframe?
I'm not sure we know whether you expect that to continue or not. I sure hope not. I think what you're hearing here, though, is it's not totally unanticipated that there might be some flare-ups in the October, November season, the flu season, a lot more activity out there. And if nothing else, we're trying to give you some confidence when it comes to testing, when it comes to the rapid response team, when it comes to the necessary PPE on the ready. We're ready to handle this and keep it contained as best we can.
Okay. And the daily positivity rate, that reflects tests that were received that had been, specimens that have been tested anywhere from several days to a week earlier. So I realize it's the numbers that we have, and it is an alarming uptick in it. But what are we seeing in terms of the 7-day average? Are we seeing what are we seeing?
I think our 7-day is still 1.2, 1.3. Isn't that right, Josh?
Yeah, the 7-day average as of today, including today's data, is 1.3. You're correct, Paul, that the data we report every day are the new test results that are reported to Department of Public Health in that previous 24-hour period. And the Department of Public Health team, particularly in their Thursday report, which is very comprehensive, also breaks that data down by specimen collection date, which is the other way to report the testing. We look at both.
Thank you very much.
CT News Junkie.
Hi, Governor. I was wondering, with the COVID situation is more dire than it was maybe last week when you announced the phase 3 coming soon. I was wondering, is there a sort of number threshold in your mind where if we hit this percentage of positivity rate that you'd put the brakes or hit the pause button, I guess, on phase 3 again?
Well, I wouldn't use the word dire, but I think there is a concerning trend when we've gone up a little bit. You know, we're still at 1/2, 1/3 the national average, one of the lowest infection rates in the country. But yes, we have said in no uncertain terms that if we see the rate of infections accelerating, getting up above a certain amount, say 4 or 5%, we would probably have to think seriously about changing course.
And so that percentage would be statewide, because some areas are already above that, right, like Norwich?
Yeah, my feeling is that when it comes to schools, you do that locally. When it comes to restaurants and other facilities where people are likely to travel back and forth across the state, it's still better to do that on a statewide basis. In fact, we did it on a regional basis going back to the spring.
Okay, getting back to the PPE, has the administration reached out to or had discussions with any local manufacturer operations to maybe talk about retooling their operation to make masks or other PPE, that kind of thing?
Yeah, absolutely. And in fact, that's been going on for a number of months. I think almost every one of the face shields, for example, that's in our 90-day supply in our warehouse is made by a Connecticut manufacturer who retooled their product line early on in the pandemic to start producing face shields. So we are working with a number of Connecticut-based manufacturers who've done exactly that.
And I'll also add, the person who's taken the leadership role on that is our Chief Manufacturing Officer, Colin Cooper, who recently joined the administration really very much at the beginning, right before the pandemic hit the state of Connecticut. And he went right to work working with manufacturers locally in the state, utilizing his background as the former CEO of Whitcraft. So we couldn't be happier with the work that he is doing on behalf of the state of Connecticut, as Josh explained, in terms of what we have within our warehouse.
Okay. And when we say we have a 90-day supply, what does that exactly mean? We're hearing from some healthcare operations, some nursing homes, that they're using single-use masks, sometimes for days at a time. Is there any time in the future we think we could get them up maybe to using single-use masks for a single use?
You want me to
Want
take
that
it?
one?
Yes. Go ahead, Josh.
Go ahead, Commissioner.
Okay, so there continue to be some supply chain constraints from time to time, particularly with some of the N95 masks. So when we say a 30-day supply, we actually have a calculator that we've been helping the nursing home industry to get trained on that asks them to calculate how much PPE they would need with a certain level of infection in their facility over a 30-day period with a particular burn rate. So we've been working with them to get that PPE stockpile up to a level where it would need to be if they had a significant outbreak in their facility based on normal use.
Okay, thank you.
The Associated Press.
Good afternoon. Governor, you said there wasn't much surprising in the Mathematica report. Can you talk about what the recommendations were that may have been something you hadn't thought about? What were the most important recommendations, and how are you going to implement them?
I was interested to know how community spread directly impacted the nature of infections at a nursing home. I was interested in the great variability between some nursing homes and others as regards staffing, as regards training, and how that would be reflected in lower or higher infection rates as well. I think those were two things that were interesting. At one point on the preliminary report, there was some thought that for-profit were a little more infectious than not-for-profit. I think Josh has said that's no longer statistically significant as an issue.
And Commissioner, what are the recommendations that you're taking from this report, and how will they be implemented?
So, we're going to be looking closely at all of the long-term recommendations. As the governor mentioned, in the short-term recommendations, there were, I believe, 22. 15 of them were directed at the state, and 7 were directed at the industry. Of those 15, we're well underway on 14 of them. They've either been completely implemented or in the process of being implemented. Remember, the governor commissioned this report in June, which feels like a very long time ago now that we're in October. And DPH has not stopped working on our nursing home interventions in that time. We've been moving forward. We knew this report was coming, but we also knew that we couldn't afford to wait from June until September 30th to continue. What I found very reassuring about the report was that the strategies that we've been putting in place to prepare for a second wave were validated by the recommendations that NPR made after they did, this scan of the environment. And in terms of the long-term recommendations, I think that they made some very thoughtful and helpful comments about engaging the long-term care industry in our planning going forward. We're in regular communication with them, but I found that to be helpful. So we're going to be looking at the longer-term recommendations as well as we move into the fall.
And Governor, New Haven today broke out some remote learning centers for these kids who still don't have computers or have not logged on. Can I get your thoughts on that? And since the state is doing better than most cities around the country, which are reporting large numbers of students not coming back to remote learning, what would your recommendations be? What have we done well that they could take?
I think we anticipated early on that there would be a fair number of students and their parents who didn't feel comfortable going back to school. And in the case of New Haven, that's everybody at this point, don't have the option of in-classroom. We did a relatively good job, I think, of getting those Chromebooks out to people on a timely basis. Most of them have arrived, not every single one of them. We had to do some training there. We had to provide them the Wi-Fi or the internet connection they needed. So that's why, unlike, say, April, May, where a lot of people never logged on, that's not true now, where I think you have about 97% of people have done it. Is it as good as a classroom? No. But are we making the best out of the situation we're in? I think so.
And in terms of these remote learning centers in New Haven, are you supporting those, or would you just rather see them get back to school?
Both. I mean, look, I applaud New Haven for coming up with remote learning centers. Maybe that's a way that kids who don't have supervision at home have an alternative, or don't have as good a connection at home have an alternative. But there's nothing like a classroom with your friends and a teacher.
Thank you.
All right, I'm getting the signal here. Deirdre, I think we picked a pretty good day to have the head of public health in our group. Look, I'll tell you from the tone of the questions, look, a little bit of worry. We've got an uptick. Are we surprised by this? No. I think it was something that we had anticipated. You heard our experts say, think about it. We've always been hope for the best and plan for the worst. Right now, I think we're well prepared to handle these flare-ups as they come along, be it Norwich, be it Danbury, be it other situations. But just to remind you, yet again, while some people are saying, yippee, we're out of the woods, slow down. This virus never ceases to surprise us in a negative way. Thanks, everybody.